and welcome to Medical Dialogues. I'm Anshika Mishra. Today we'll talk about men with inflammatory joint disease less likely to be childless than healthy peers. Men with inflammatory joint disease such as rheumatoid arthritis are less likely to be childless and have more children than their healthy peers, according to the research published online in the medical journal Annals of the Rheumatic Diseases. Autoimmune diseases are on the rise, and impaired fertility has been reported in Norwegian women with inflammatory joint diseases. But only a few studies looking at the potential impact on males' fertility have been carried out. To explore these issues further using childlessness and number of children as proxies for fertility, the researchers drew on a national group of 10,865 Norwegian men with either rheumatoid arthritis, that is 37%, psoriatic arthritis, that is 33%, or spondyloarthritis, that is 30%. Each of them was matched with 5 healthy men, that is 54,325 from the general population. Between 1967 and August 2021, 1,11,246 children were born to the total number of 65,190 men. Average age of first-time fatherhood was 27 among the men with inflammatory joint disease and 28 in the comparison group. The average age at the diagnosis was 44. Births and childlessness were divided into 3 time periods, reflecting major changes in drug treatment for inflammatory joint disease. That is 1965 to 85 before the advent of methotrexate, that is 575, 1986 to 99, methotrexate, that is 1,360, and 2001 to 21 with the use of biologics, that is 8,930.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possess in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
The average number of children each patient fathered was 1.8 compared with 1.7 in the comparison group, and around 1 in 5, that is 21% of the patient, was childless compared with more than 1 in 4, that is 27% in the comparison group. The difference in childlessness and number of children between the two groups was seen in all brackets, except for those around 19 and younger. Similarly, the proportion of childless men remained significantly lower among the patients than in the comparison group for those diagnosed between the ages of 20 and 79. These differences were consistent over time, but the largest difference in number of children was numerically highest for those diagnosed after 2000, average of 1.8 versus 1.6. These patients also had the lowest risk of childlessness, 22% versus 28%. They conclude, male patients with inflammatory joint disease may be reassured that no impairment of fertility is expected. However, sub-studies according to specific diagnosis should be performed to offer more targeted patient information. Our findings of less childlessness and a high number of children appear in patients with inflammatory joint disease is novel and generates a new hypothesis regarding association between fertility, inflammatory rheumatic disease, and immune modulating drugs. This ought to be investigated further. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.